the struggle is on to reduce the number of opioids people that are taking on an ongoing basis, and that's going to mean we're going to have to reduce their anxiety levels, and we're going to have to be able to decrease the sympathetic system. And one of the ways you can do that is meditation, but these guys have taken it to a whole new level. And so what we can do with this technology is use it to not only help reduce pain, and thus the amount of pain medications you're on, but we can also use it to help you sleep better, which is something we're always struggling to try and accomplish. So what I have here is two gentlemen here, Dr. Bruce and David Poole from NuCalm, and they're going to tell us about the product.
The product is an all-natural stress intervention therapy. It's a 4-part system. You've got a topical cream that includes amino acids, GABA and L-theanine, that are considered relaxation fuel. Then we use a class 3 medical device. It's a CES device, and you put neuro patches behind the ears, one on each side, right in this soft spot behind the ear, and that's going to excite the GABA receptor sites, open that up and bind with the ingredients and the amino acids. That's going to put the brakes on adrenaline at the midbrain, so it normalizes the stress response. Then we have an app that drives a pair of headphones that presents you with a music phenomenon or experience, but embedded in that music is a very sophisticated potpourri of physics that's going to do brain hypnosis and entrainment. And then lastly, we block out light, which makes your central nervous system feel safe. And we force you, if you will, into deep relaxation in about 90 seconds upon administration.
So this is really quite fascinating. And the way I think of it is what NuCalm does is it turns off the stress and anxiety faucet and it turns on the relaxation and healing faucet. And that's how it kind of works in the brain. Now, as an integrative medicine specialist, you know that GABA is very important in a lot of what's going on as far as stress reactions and anxiety. So what we do is with the cream, we add the cream and then we have a very mild excitatory signal that goes in, then basically opens up those receptor sites in the brains, and man, I got to tell you something, sympathetic just dumps. It just goes straight down, which is great for chronic pain people because we know that when you talk about pain and sleep, we know that people in pain don't sleep very well, but what's really interesting is anxiety appears to be one of the modulators of this. And so when people do, because a lot of people think, oh, it's just the pain. People with chronic pain are used to chronic pain. What they don't like is the anxiety associated with it. That's where this comes in and it's so cool. But the thing that I like about this the most is you don't see any pharmaceuticals here, right? And that's what I like. We're actually opening up the body's healing powers from the cells, much the way integrative medicine was founded, right? And that's exactly what we're trying to do is open it up and let the body heal itself. It's really cool stuff.
The other thing that happens is, like meditation, the more you use it, the more benefits you get it. So it's not just a matter of getting benefit from it from the time that you're utilizing the product, but rather you see a spillover effect that accumulates over time. What's been your experience with that?
So it's really interesting because over the course of time, what people tell me is they're like, at first, it was kind of strange because it happened so fast and I was already in that meditative state and I'm not a meditator. And then they start to get better at it, and then what they were finding is they're actually seeing enhanced effects. So they're finding themselves calmer throughout the day. When anxiety situations present to them, they're not as reactive as they once were. So it's really very interesting, but the more you use it, the better it gets. So there's actually two versions. At the show, we're actually showing the prototype. So this, what we see actually back there, is Renew by NuCalm. So it's all in one unit, and the price point is significantly different, and it's a subscription-based model, so people can get different audios and things like that. It's really pretty cool. Historically, what's been used is the medical professional device model, right? And so that's 510K clearance, like the whole nine, much different price point, and that's what we're showing people here. But I would say 75% of that technology is in this device over here.
So when do you think this new device for the consumers will be available?
This will be spring 2018, this year.
This is very exciting. It's all about how can we get your own internal pharmacy working and decrease the number of drugs that you're taking.